Okay, well, welcome everyone. I'm Susan Blum, and I am here to offer a conversation about COVID and about vaccines and anything that's on your mind. And I seem to answer questions all day long from my patients, and I am busy reading everything that comes across my desk. And of course, I have some of my own opinions, and I guess that's why you're here, because you want to hear what I think. And so I'll do my best, to share information as well as to share. Some of it will be opinion, and I clearly will tell you when that's the case. And some, we'll try to discern some good information for you and answer your questions. So this is really a Q&A format. And so first, I just want to say welcome to those of you who are not here in this moment. The overwhelming majority of you are not here live. And so we have people from all over the world, which is wonderful, that are going to get this recording. So welcome to all of you. And so this is going to be recorded, and everybody who signed up for this recording tomorrow, it will be converted. Sarah's going to put it on YouTube, and you will get a link and you will get the recording. A lot of you did send in your questions in advance, which was great, because I actually went through all the questions you all sent in, and it was clear to me sort of what the biggest concerns were, looking at your questions. And so I'm gonna, and as is the case whenever we have a group setting, usually the questions that somebody's asking, are relevant for you. Like, pay attention, all the questions, a lot of them might resonate for the things you're wondering as well. If you did not send in questions in advance and you want to send in questions to me now, here's how I want you to do it. Now, I know there's a Q&A, so somebody already put it up in the, I guess we could do it that way, and I could just move the Q&A over here. So there is a Q&A button, and you can type your questions in the Q&A. And I will try to, so what's going to happen first is I'm going to talk about everything that I have sort of planned to talk about based upon the questions that were sent in advance. And then we'll pause, and I'm just going to start looking at questions, and hopefully we'll have time to finish them. I'm really only planning on this happening for about 45 minutes. So, and maybe we'll get through the questions even before then. Okay. So again, welcome. That I think is just those basics. What I would say is that the majority of the questions that you all had have to do about vaccination, about boosters. Like boosters are like the big thing. And so let me just go through some of the questions you all had about vaccination with some of the answers. Right now, vaccination, what's considered to be, getting vaccinated, a complete series, is Moderna, 2 shots, Pfizer, 2 shots, and 1 shot of J&J. Okay. And so, however, that being said, there are people who are seriously immunocompromised, and perhaps even their doctor checked, and if this is you, your doctor checked your antibodies, they checked your level of response to the vaccine and found that your levels were low and you didn't really respond well, and therefore you got a 3rd shot. Now, a 3-shot series for people who are immunocompromised is not the same as getting a booster. So some people actually got a 3rd shot to complete their series, and they just got a 3rd shot of the same vaccine. And so I do want to differentiate between the definition of a 3rd shot, where some people had a 3rd shot as part of their original vaccination, and a booster. A booster is an additional vaccine that you're going to get after finishing your original series. Okay. And so there's a lot of people who have gotten 3 shots, and really because because we know from either their own test or from studies that were done that they are not likely to have had, or they didn't have a good response to the first 2, and it looks like they needed a 3rd, right? A little thing about how boosters work. And we've been giving our children, and we as adults have had boosters always, like our whole lives that I remember, my whole adult life, and even as a kid. And I gave it to my kids. And so what happens with the reason it's called a booster is because you're supposed to get it at a distance from the original shot to give your immune system a lot of time to get all primed and ready. And then you get a boost. And you don't need, usually it's not the same dose as the first ones, right? And it's a little lower dose because you don't need as much. And it's somehow, because of the distance and because of the opportunity for your immune system to have gotten primed and really like ready, the booster amplifies in a much bigger way your whole your immunity, like really amplifies it. And so waiting the right amount, having the right amounts of time, or letting time lapse between your shots, your original series, and the booster, it's actually, you get boosted better by waiting. And I know it's a little counterintuitive. You're like, hurry up, I want to get a booster really quickly. But actually, sometimes the longer you wait, the better. I think hepatitis is like there's 9 months, or like the childhood, it's like years, there's a year of spacing between some vaccinations. And so it's okay to wait, okay, is the first thing I want to say in terms of the effectiveness of the whole process. Okay, so that's the first thing about boosters. The other thing about boosters is that deciding when you need to boost yourself is about your own personal medical history and what we know about which vaccine you had. So we know that the Pfizer vaccine is starting to wane after 6 months. And some people, I know I tested my husband who has no medical health issues, and he started dropping from he was at the max at the beginning, and now he just started dropping, and that was 6 months. Right at the 6 month mark, he started, you could see it just came down a little bit. So I could see it's coming down. And so I am a believer of testing, and somebody did ask that. And if you're going to get an antibody test, you have a vaccine antibody, the one that's specifically for the vaccine, not easy to come by. It's called a spike protein antibody test. And here in the Northeast, there's Northwell Health. I think, and they might be elsewhere too, because I've been trying to, some of my patients elsewhere seem to be able to find Northwell, but Northwell has a great sort of COVID spike antibody test, which just checks the effectiveness of the vaccine. And because generally healthy people are probably going to be good for a while, but we do believe that Pfizer people seem to be dropping. Moderna people seem to be holding their own a lot better. And so I just checked myself. I had Moderna, my husband had Pfizer, and I'm still super high. And so I'm still like at the maximum level. So I'm not going to get a booster yet, because even though I had my second shot in February, March, April, May, June, July, August, September, I'm going on 8 months. So that's sort of the part A to I'm sort of telling these stories as a way of answering a lot of the questions that came in, to see, to understand my thinking on this, okay? And so not everybody has access to antibody levels. So here's the thing. If you had Pfizer, then I do believe you should get a booster. And there's a lot of different, I'm going to go through the details of people's questions about that. But Pfizer people, it looks pretty solid from the literature and from the data that 6 months, when 6 months hit, anytime thereafter, no matter whether you're high risk or low risk or old or young, in terms of where you are in the risk spectrum, it's probably wise to get a booster, especially depending on where you are. And here's the other piece. Are you still quarantining? Are you still home with a mask on? Are you still social distancing? You know what I mean? Are you being really careful still? Are you living in an area where there's just not a lot of widespread, infections happening, or COVID? And so if you're living in an area, I'm in Westchester County, New York, things are quiet-ish. They're not bad. We have 3% positive testing rate. Our hospitalizations are coming down. It looks like we're coming out of the surge. And I'm still wearing a mask everywhere. My husband does. So we sort of stopped eating in restaurants inside without a mask. It would be nice to be able to do that in the winter. And so he's getting his booster shot on Friday. I'm waiting because I had Moderna, and I actually don't want to get another 100, the full dose for my third shot from Moderna. I'm going to wait until it's time. They come out with the booster, which is going to be the half dose. Because Moderna, it turns out, is twice as strong as the Pfizer vaccine. It's a much stronger concentrated vaccine. And so I don't feel, for a healthy person such as myself, and I'm 61, so I'm in, I don't know what age range where you want to put me. But this is why it's a very one-on-one decision about what you want to do. So for myself, I know I'm still being very careful. I am in the office. I am seeing patients with my mask on. But my kids, we are having a baby in the family. I'm going to be a grandma, and I'm flying to Colorado when the baby's born in November, December. And so I might go ahead, I might figure out, I'm hoping that maybe the Moderna boosters will be ready by then. But I'm going to test my antibodies again in November before I go, and as things are getting closer, and just see whether or not I'm still super high. And if I am, I might not actually get a booster. So this is the dance, right? And so the specific questions you had were, here's some of the questions. So number one, if someone had COVID and natural immunity, do you still need to vaccinate? Okay, that's not a booster question, that's a vaccine question. For people who had COVID, I believe you still need to vaccinate. And this is why the Delta surge, and so a lot of people had COVID at the beginning before it was the Delta variant. And the amount of protection that you have against Delta, if you had the Alpha, which was the original strain from last year, is probably not great, or as good as it will be if you get vaccinated. And so I definitely feel people who had COVID should go ahead and get vaccinated. It's almost like, though, if you had COVID, that's like your first shot, right? And then if you had another series of 2 more shots, you might not need a booster. You might want to go get your antibodies tested. You see, this is where we're going with all of this, right? And so we'll see what happens with the surges and as things are settling out. People who had COVID, I think we don't take into good enough, we don't give them enough credit. We don't give you enough credit for the amount of immune activity you already have. So it's sort of like having a one shot, and so I think, yes, I believe you need a vaccine in order to really protect yourself from Delta and from getting really sick. But you will have some protection for sure from having had it. But it looks like, as you can see, where everyone is, rushing to get boosters, is that we really need, there's like added boosting of our protection that it looks like we need, and it depends on where you live and how much you're out and about and how much exposure you have as you make this decision. Someone with diabetes type 1 asked about okay to vaccinate. Absolutely, and that's just another autoimmune disease. So for those of you with autoimmunity, yes, it's okay to vaccinate. Now, some of you wrote in and you're very concerned. People who had terrible side effects, or people who had even like anaphylactic reactions and like bad kind of side effects. Millions and millions and millions and millions of people have had these vaccines now. And we're going to be going on 8-9 months of vaccination. It's already 9 months since last December. Yes, there's definitely people who have had some serious side effects from it. But statistically speaking, it's no more than the flu vaccine or other vaccines that have been around in terms of as a percentage. So this vaccine isn't any more dangerous than any other vaccine, right? As far as I can tell, that you're never going to have zero in terms of people that have that react or have serious side effects. So you are going to have that. And it's your own personal decision if for you that makes you or is too frightening, to go ahead and be vaccinated. But what I would say is that, yes, there will be people with side effects, but overwhelmingly, the vaccine appears to be very safe. Now, do we have 5-year studies or 10-year studies? And there are definitely people out there talking about concerns about, that it's a new vaccine, and that's true for the RNA vaccines. And so if you're a person who's really worried about that, then I would say go ahead and get the Johnson vaccine, because that is made just like the flu vaccines are made. They're made the old-fashioned way in chicken eggs. It's like the old-fashioned kind of vaccine. So if you're a person who's really nervous about the newness of the vaccine, it's really just about the RNA vaccine. If you're nervous about that, then don't get it. Go ahead and get the Johnson vaccine, which is, I'm calling it Johnson. I don't know, it has J&J or Janssen, I don't know what it's called, but I'm calling it the Johnson vaccine. That one-shot vaccine is a great choice if you're really nervous about the new technology. All the vaccines are really providing good protection. And I do believe there's going to end up being a booster for the Johnson one, and there is going to be a booster coming out for Moderna. But I believe the Moderna booster is going to be of a lower dose than the original shot. If you're a person who had Moderna and you have a serious underlying, an autoimmune condition, not just autoimmune, if you're immunosuppressed, if you're on medication that causes immunosuppression in the body, which means your immune system is dialed down, then it's okay to go get the third shot of Moderna now, because you're allowed to. It's part of your original sort of third shot series. So if you want to think of it like a booster, you can think of it that way. But for immunocompromised people, yes, go and get the third shot. Now, there are a lot of people who wrote in who are over 70 or 75 and said, should I go get a third shot of Moderna, or should I wait for the booster of Moderna? And I would say that's a tough call, because I don't know, I guess as we get older, it depends on your health. There's people who are 75 who are like super healthy, and there are people who are 75 who are a bit, have a lot of inflammation, and have some health issues that they're struggling with, especially ones that might put you at high risk for getting very sick, like diabetes or hypertension, or if you're very overweight or have a big belly, the metabolic syndrome. People with cardiovascular disease who are very overweight, the people who are at risk for getting really sick for COVID, that suggests there's a lot of inflammation in your body, and maybe you would want to get a booster sooner if you think you would get very sick. So I do think it's a personal decision. In my office, I am running antibody tests on everybody who wants them. And if they want that to help inform their decision, that's fine. Some people just want to go get, so I would say if you're in your 70 or you're over 70 and you're generally really healthy and you really are still taking good precautions, you can wait for the booster to come out from Moderna. You can also go get your antibody levels tested to see if you're starting to drop. And if you are, then go ahead and get the booster. Well, it's really almost a third shot because it's not a booster dose, right? A third shot. So let me see what else. I know I don't want to ramble around too much. I want to just see. So another big question was, what if you had the Moderna or Johnson vaccine? Can you cross over and get a Pfizer booster? A lot of you asked about that. And I just don't know how to answer that. We have no data. We don't know what happens if you do that. We just don't know. Now, some of you said, I think I had a terrible reaction. Somebody asked about a terrible reaction to Moderna. You think you had a reaction to the polyethylene glycol in there and you want to switch to Pfizer. Chances are that's really fine. I can't imagine why it's a problem to actually get a Pfizer booster if you've had Moderna before. You're entering into the land of unknowns, right? We just don't know what would happen. From a medical pathophysiological perspective, I don't see why that would be a problem. We just don't know. I guess we couldn't give you statistics on what your immunity will be like, but it seems to make sense that it should boost your previous shot. It should just work as a booster for you. But we don't know for sure. And so really the CDC is encouraging people to stay in line with their usual, but apparently in Europe, they're crossing over and people are getting all different shots. So I'm not going to tell you not to get a Pfizer booster if you've had, or to switch, especially if you didn't like how you felt on Moderna, or there's a lot of you who wrote in who had side effects or felt flares of your health issues from the Moderna and you don't want to get it, you're worried about getting it. The Pfizer vaccine, the Pfizer shot is less strong. So it is almost like getting that half dose booster. So I would not get a full dose Moderna booster yet. or a third Moderna shot if you really reacted and still have some inflammatory after effects of your second Moderna shot. Certainly wait for that half dose and wait a while until you need it. Some people are crossing over and getting a Pfizer booster, and that's sort of up to you. I'm not going to tell you that I recommend you do that because I don't have any medical standing to tell you to do that. And I'm not your doctor, and I can't give you medical advice. So this is not medical advice. This is just us having a conversation and talking through what I know from data and what I don't know. As if you're a patient of mine or in our practice, and this is a conversation you want to have, we can do it as more of I could offer better medical advice about it. Okay, well, I hope that's making sense. We'll keep going, it'll maybe get clearer, but you're going to see, I don't have like definite yeses and nos for you, right? So next question, had a reaction from Moderna, would like to switch. No data on that. No data on that. So yeah. And so that's going to be your choice about that. Again, I'm just going to say, it's hard to imagine how that will be harmful, but we don't know. There's no data for us to really know how that will boost your immunity either. What exactly will happen. A lot of people asked about, should I get the boost? Should I wait to get the booster when it's ready for Moderna, which is the 50 microgram dose, or get the current dose of 100 now? And again, my answer is it depends. If you're immune compromised, you should be getting a third shot anyway, right? So yes, go ahead and get a third shot, which being offered to a lot of doctors are sending their immunocompromised people to get third shots anyway. You can get your antibodies level and see. But I think that the bottom line, as I'm sort of thinking about it, is if you aren't traveling and you're still using masks and social distancing, then, why not wait? You can wait for the booster dose. Like, what is the urgency, right? You've had your 2 shots, you have good immunity, you can wait a little bit, okay? If you are high risk though, immunocompromised, or you're 8 months out from your first shot, which a lot of you aren't. A lot of people are not I'm barely 8 months out. And I went very early. Then, but if you're high risk, immunocompromised, going somewhere, traveling, going on a vacation, getting ready to fly, it's a different equation for you, right? And then you might decide you should go ahead and get your third Moderna shot and not wait for, not wait for the dose to be changed for it to be called a booster. And then of course, my note to myself that I wrote was, if you had a bad reaction to Moderna, you can consider crossing over to Pfizer, but remember, there's no data for that. And a bad reaction isn't just, like I had a bad reaction to Moderna, like I had fever and chills with low-grade fever, but I had chills and a low-grade fever that night for, actually, I think it was the next day at like 4:00 in the afternoon for my second shot. And I had a migraine the first night, and I'm not a headache person. And then the next day I had 2 to 3 hours of fever and like chills, low-grade fever, and then it was gone. I don't consider that a bad reaction. A bad reaction is, some of you wrote in and you had flares of your arthritis, you had flares of your Sjogren's, and you're still like coming out of it, right? And that's, and so maybe that is from the polyethylene glycol, maybe that is from the high dose that's in that vaccine. And so that's, though, for you, the idea of crossing over to Pfizer, I think I can see that. And so I can't medically recommend that. And I have to tell you, there's no data for it, but I can see that being a consideration. So a lot of you asked about, I'm going to come back and look at I see there's a whole bunch of questions here now, a lot. We'll come back to that. In terms of vaccine injuries, some people asked about that, and they asked me whether it changes my mind about vaccines. And I think I answered that a little bit at the beginning. It's a terrible thing, vaccine injuries, and it happens with vaccines. And remember, there's millions and millions and millions, there's a billion shots that have been given around the world so far. A billion. It's a lot. And, the data is pretty good. I mean, there's definitely side effects, and there are people that have had, very difficult side effects. And probably some people, I mean, somebody wrote in about somebody they know that died, but I have a feeling that was an anaphylactic kind of a thing, an allergic reaction or something, because it was right 10 minutes after the vaccine. And those things are scary and they happen, but I'm still not changing my mind about the vaccine. It's the only way we're going to get out of this. Who here that's listening today would have thought that we would be here in year 2, that we're heading into our second COVID winter? Who would have thought that, right? And so it'll be 2 years in March. Where did that go, right? And we wanted to, hopefully we're done in the spring. And well, when I say done, what I predict, I'm hopeful, this is the best case scenario that I'm sort of hoping for, and that I think is very possible. I think we're going to come through the winter. I think we're going to have what are called microsurges. And so I think the vaccine, the places where there's a lot of vaccination it's going to stay quiet. But even here, like in New York, there's pockets of people who are not vaccinated. And this virus is going to find and seek out all those unvaccinated people and infect them. And so there's going to be microsurges. And so we're going to have little surges in New York because the people who are unvaccinated are going to get infected. And so the Delta is going to make its way around the country all winter, having little surges everywhere. And there's areas where there's a lot of unvaccinated people, and they're going to I predict they're not going to have a great winter this year. But in the places where a lot of people are vaccinated, there's going to be mini surges because there's still, wherever Delta finds pockets of people who are unvaccinated, there's going to be infection. So we're not done because there are too many unvaccinated people. And so I think for the next 6 months, we're going to have just a lot of little bumps. But depending on where you live, and if you're in a highly vaccinated area, life is going to probably get back to the new normal. It's not going to be normal because we're going to find what I'm calling, and I read this, I'm stealing this term from somewhere. It's called the manageable middle. It's not going away. We're going to be in the manageable middle. It's going to be like the flu. It's going to be around. We're going to have to be careful. It's going to keep spreading until it's going to find pockets of people. And we all just need to continue to stay vaccinated and immune. And the hospitalizations and deaths are going to go down, but people are going to continue to get infected. It's going to make its way through our kids pretty much. And there are surges certainly with the kids too. And I think that's probably the higher risk people, but Delta's getting, especially in the young adults, 40 people in the 30s and 40s who don't appear to have high risk issues are getting very, very, very sick and ending up in the hospital. So I think Delta's going to make its way around. And so I think it's going to be here, but I'm hopeful the spring is going to feel like spring. And we're going to be able to come out of the winter and feel like we can sort of start living without our masks on all the time, which will be great. And so I'm hoping the spring will see this thing sort of receding, but we're here for another 6 months. We're going to have another COVID winter, and who would have thought that? So the only way any of us are getting out of this situation of staying home all the time and COVID ending up in remission, where it's in the background, spreading around like this manageable sort of background noise, is to get vaccinated or to get COVID. Those are your only two choices. You're either going to get vaccinated or get COVID. So no, I haven't changed my mind about vaccines. I have not changed my mind, even though, yes, look, I have my master's in public health from back when, and from a public health perspective, epidemiology is looking at like the statistics and the numbers for 1 million people, and there's always going to be like a couple of percentages of but when you have 100 million people, 2% of that is still a lot of people, right? but you think about the 98% that are just doing fine and immune. So that's where I come out on that. Now, one of the questions was, though, how can we lower our risk from side effects from the vaccine? And what I do want to say about that is that in our office, Vicky, we have an amazing functional nutritionist who actually specializes in vaccines, because she works with, she specializes as a pediatric nutritionist working with autism. And in the autism community, vaccines have been, the work on vaccines and ameliorating and protecting the children from just the way we give vaccines, has been a really big movement. And so she has this whole protect yourself from like pre-vaccine and like post-vaccine protocol. If anybody really I'm going to send, so I'm not going through that today, but she does have her, there is a vaccine protocol, that a pre and post-vaccine protocol that I will send out. So tomorrow or whenever it'll be, I'm going to send out some information for you guys. So look for it tomorrow. And there is a vaccine protocol. It's really the stuff you've been doing. It's like vitamin A, D, C, zinc. Glutathione is a really big one. Glutathione really is a great protector of the immune system, of antioxidants and detox, to help sort of detox from the vaccine a little, as that's a protector from before. And so, this is this sort of her protocol. So anyone really pretty much from anywhere can reach out and have a consult with Vicky if you have specific questions about a vaccine protocol. But the general supplement, protocol, I can certainly share with you guys, which I will. And so, but not here because it's too long. So it'll come out in an email. But the point is that the healthier you are, it's about having less inflammation, good basic immune support, good antioxidants, supporting your detox system a little, which is really a lot about antioxidants, can help you lower your risk of the vaccine, in our opinion. Don't have data for that, but this is what Vicky's been doing with kids for many, many years, and with good success. So we've adopted her vaccine protocol. People asked about children and vaccines and sort of what I think about that. I asked Vicky that question in the office yesterday or this week. When did I see her? Tuesday, which was yesterday. I said, so let's talk again about kids. And, we're a little reluctant about recommending vaccines to the kids yet. Haven't seen enough data. Kids are really sensitive to the stuff in vaccines. And so the children under 11, the next age group, the 5 to 11, we are not quite ready to we're not quite comfortable recommending it yet to the kids. And because we do know that vaccines can be hard on them. And so more on that later. But somebody did ask me about that. I'm not saying don't do it. And again, here we are with your personal belief, where you live, the amount of risk that you feel your child has, and your family has. If you have immunocompromised people at home and you're worried about the kid coming home with with COVID, what's your community like? What's the school like where your children are going to school? Does your child have anything high risk where you want to, vaccinate them? And so it's like not one size fits all. It's really, you need like an individual decision. And if you have children, and this is about children, Vicky's a pediatric nutritionist, dietitian, but she's a functional expert. You can always my office, just go on blumcenterforhealth.com. Well, you all are on my newsletter. Call our office. You can schedule an appointment with Vicky for like this sort of a vaccine consult or something like that for your kids. And she can do that for you. So, because it's a very personalized decision, and a lot of people have a lot of trouble with making a decision, and you need advice, and I understand that. But just keep in mind, we're having a discussion here, and it's not a personalized prescription or medical advice for you. A question about whether the vaccine works in immune compromised people, and I want to say yes, mostly. mostly most people are responding, but they did find that it's weak, and a lot of people do some medication that people are on really suppresses it. And the third shot seems to make a big difference. Remember at the beginning of this talk, I said that there's something about having this long distance between the initial series and the booster. A booster is called a booster because it amplifies in a really great way the original vaccine. We're now reaching a point 6 months, 8 months out, or with distance, where you can actually experience that kind of boosting effect, where it really does amplify it. So I'm hopeful that the boosters are needed, and the immune compromised third shot, whether you want to call it a third shot or a booster. And somebody asked about whether or not the immune compromised people are the people in the hospitals. And from what I've read, the people in the hospitals are the unvaccinated. At least 85% easy of all the people in the hospitals are people who have not been vaccinated. Of the other 15%, the people who are getting sick or ending up in the hospital that were vaccinated, it's a really good question, and somebody's got to provide us with that data at some point about who are those people that are having the worst breakthrough infections, right? It makes sense that it would likely be people who are immune compromised or who didn't have a great response to the vaccine or have a lower antibody response. But I haven't seen any research yet looking at that. And I read everything every morning that comes in. I have all this I've subscribed to every sort of channel in the medical world to look at everything that comes in. So we don't know yet. Somebody else asked me about whether they should get a flu shot this year. And all I'll say about that is that if you plan on being careful this winter like you were last winter, I don't think so. Because last winter we had no flu season. Everybody was home, everybody was masked and social. However, if you live somewhere where you're planning on going out and you're going to throw your mask away and go out and about, I'm still wearing my mask, as I recommend you all do, in a public place when you're grouped together with people. I went to my first wedding this past Saturday night, and we didn't wear masks, but oh my God, we got tested. We had to submit we were all required to be vaccinated. I had to get a COVID PCR test and submit and upload the results before they would let me in, and my husband and I, into the wedding. And so there was this whole sort of requirement in order to go. And so, and here's the other thing about being vaccinated and the idea of being around people without your masks on. This is where it's a little bit tricky, right? Like, how much do you have to worry? How much do you have to mask if you've been vaccinated? And it's really up to you and whether or not you're worried about yourself or other people, at home. From what I've read, it appears that people that have breakthrough infections, even though they're vaccinated, that are getting COVID, they are not easily spreading it to other people. It's like they're getting sick, but no one else in their family is getting sick. Somebody who's unvaccinated who gets really sick, this happened to my kid, my sister's kid, like my nieces and nephews and their whole family. Like, one of the kids brought it home, everyone got it, all the other kids. And both parents got breakthrough infections because the kid had such a big volume that he was pretty sick. He was actually very sick, not hospitalization level sick, but miserable flu for a week sick. And he got everybody sick. When somebody who is unvaccinated, they have a huge viral load in their body. It appears that those of us who are vaccinated, if we get a breakthrough infection, we're not spreading it to 10 people. In fact, it looks like we're not even, I just know, I have so many stories of someone who had a breakthrough infection and their spouse who slept in the bed with them, or, that just didn't get it, right? And so not every, it seems that it just doesn't keep spreading like that. So even people who got breakthrough infections, they don't seem to be really infectious in a big way. They get it, and then they don't spread it. Okay, well, I launched off on that when I was answering the question that was asked about the flu shot. So I still recommend that even though I'm vaccinated, it's possible that I could bump up against someone who's unvaccinated and get sick from them. and I don't want to get sick. So I'm wearing a mask when I'm inside. In my office, we're all masked up. And so if I'm trying not to get COVID from someone, I'm not going to get the flu. It's the same way you spread things. So if you're wearing a mask in public places, you don't have to wear a mask when you're outside. But if you're wearing a mask in a public place, you could pretty much. So anyway, last year I told everyone, why are you going to get a flu shot? Like, there's no flu. And I suspect the same thing is going to happen this year, unless you live in a community and you plan on being out and about without a mask as if COVID's over. And if that's what you and all your neighbors are doing, I don't think that's those of you who are on this call with me. Those of you who are here, I think, are really interested in being safe. So I don't expect that's going to necessarily be you. And a lot of you have these health issues, and that's why you know me. And so I'm not sure you're going to need a flu shot this year, because you're all going to be taking precautions. So a couple of questions about ivermectin. Okay. So I would love to love ivermectin. And as a matter of fact, I have a really, really good friend who's Mexican. And she, at the beginning of the pandemic, she called me and said that everybody down there is taking ivermectin. And I'm thinking, wow, this is so great. You know, I cannot recommend it as much as I would like to. There's a theory about how it works. There's a theory about how it works in the dish, in the lab. It does not work in people the way the hopeful idea of it works in the lab. They've been studying, there's been many, many studies now, because everyone's been taking it. And there's this whole crazy thing about people taking the animals ivermectin. Don't do it, okay? And it's definitely not for prevention. And it's a very, very toxic drug if you take it over a long period of time. Ivermectin is meant to be taken for like a day or a couple of days. You can't take it daily for prevention. It's going to damage your kidneys. And so so the answer is no, I can't recommend ivermectin. And I've read and opened up the studies that were published about it. And it just has not been proven good, or that it works. Now, if you're looking for something for prevention, here are my two. So when somebody asked about double masking and distancing, yes, that works. But the other big trick that I have for prevention, which I was excited to be reading about, because I flew recently, I went and finally met my girlfriend, my gal pals, who we haven't seen each other. There's a group of us, we haven't seen each other in 2 years. And we all met in Minneapolis, and I flew. There's a lot of studies, like in the ENT literature, about swabbing and cleaning your nose. Because if you think about it, the virus just replicates in your nose before that's where it enters your body. It's in the nasal passages. And so there are these iodine swabs. So you use iodine. You swab your nose with iodine before and after something that's high risk. So something happens, you come home, or, I swabbed my nose before I went to the airport, and then when I got off the plane. And you can go on Amazon, actually, and there are these Q-tips, they're iodine nasal swabs, and they're an individual wrapped. Oh, dang, I should have brought it with me so I could have shown you. But it's like this individually wrapped Q-tip with like iodine in it. And you snap the top, and the iodine drops into the fuzzy bottom of the Q-tip, and you just use it in your nose. So I did one Q-tip for each nose, swab myself with iodine. It's great. And there's actually studies looking at iodine. It's 2 to 3 hours. It kills everything in your nose for 2 to 3 hours. So that is like so safe. It's a great prevention tool. And so, all of us in our office, this is the thing we're doing now. And so if you go anywhere and you think you're concerned about exposure you might have had, just swab your nose before you go to bed. And so someone in our office it turned out she didn't have COVID, but she called in sick that morning. We had all seen her the day before, and then the next day she called in sick. I swabbed my nose that day, right? Because you're gonna decrease the amount of virus that might be in your nose. So that's my big tip for prevention. And there's data for that. The other thing I wanted to point out is about testing. In Europe, they're using rapid tests everywhere. And so I was initially very sort of negative about the rapid antigen test, it's called. It's the quick test, whatever you want to call it. But it's not PCR. It's just it's looking for the DNA, the antigen. It's an antigen test in your nose, and you swab yourself. It's a home kit. You can get it from CVS. It's a home kit. You do it in your own nose. You do it in the thing. You look and see if the line's like a pregnancy home test. You see if the line comes up. It turns out that those tests are being used in schools. I mean, they're going through the companies and the schools in Europe. Everybody's testing everybody like every day or all the time, right? And we were very negative about these tests, or I was at first, because they're not as sensitive. But it turns out that they're super great, 98% good at picking up someone who's infectious. If you have to have tons of virus in your nose for you to infect someone else. And that test will pick up 98% if you have enough in there to infect someone else. The PCR test is supposed to be super sensitive. So even if you have 4 virus particles in your nose, it'll say you're positive. It doesn't mean that you have enough to infect someone else. And so we've adopted in my office a policy of, if you're sick, I stocked up on those kits. I gave them to everyone all of my admin team, like everyone who works there. We all have kits at home now. And if you wake up feeling sick, you're going to do your own test. Of course, stay home too, but you can do the own test, because we want to be able to tell our coworkers and our teammates that we are positive, so that the rest of us could swab our noses and be a little bit careful and check ourselves for symptoms. But because we're being careful in the office and we're all vaccinated, chances are, even if somebody becomes positive in my office, I don't expect they're going to transmit it to someone else. And so that's the nice thing about being vaccinated. It's unlikely you're going to keep spreading it forward, even if you get a breakthrough infection. Okay, so those are all the questions that people called in with. I'm going to start at the top of the Q&As that people sent in, and we'll go down, okay? So I have RA, I had COVID. I'm sorry, that must have been so hard. I am choosing not to take the vaccine. I have never had a flu shot in my life either. My concern is, when might it be safe to go to places with a lot of people after the winter? I have absolutely no idea. And I understand you choosing not to get vaccinated, and I honor your decision. You likely do have some immunity, but I think you're still at risk. Hopefully you're not at risk of ending up in the hospital and getting really sick, but you're at risk of getting COVID again, especially if you had COVID at the beginning. When you say you have RA, I don't know if you're on any medication or immunosuppressive medication. And I hope you fully recovered from COVID now. But I don't know how to tell you when it might be safe. Honestly, I think maybe you could ask your doctor to measure your antibody levels. We have one of our team members in the office. She had COVID at the beginning. She was so sick. And we measured her levels. They were super high. And she's like, I'm not getting vaccinated yet. I'm going to wait. I'm like, okay. So that's really up to you. But I don't know that when you say safe to go places with a lot of people, I think if you want to go to church, probably after the winter, yes. And if you want to go places, I think it's safe to go with a mask on. But I wouldn't be unmasked in church with people. I think you're risking a breakthrough infection. And I think all of us still are. I wouldn't, as a vaccinated person in a crowded place with a lot of people, I still this winter would not be unmasked. I still would be wearing a mask because we're not quite out the other end of this thing yet. And it depends on where you live and how prevalent COVID is in your community. What about testing for antibody levels before a booster? Yes, I like that. Not all tests are, and I talked about that. You need the COVID spike protein test. They have to be specific for a quantitative, which means you need a number. COVID spike is the test that you need. Is it safe for pregnant women to get the COVID vaccine held late early in the pregnancy? I will tell you, my daughter-in-law is pregnant and she got vaccinated during her pregnancy. It went just fine. My other doctor, one of our doctors in our office, is pregnant and she got vaccinated while pregnant. She's actually going for her booster and she's like 8 months now and she's going this week for her booster shot. She got She got vaccinated. I wonder if she got, you know what? She got vaccinated, I think, right before she was pregnant. And so now she's going for another shot, or maybe she had her second. I don't even know, but she definitely got shot. So I think pregnant women appear to be super safe. The studies have come out on that is really good. And then you give the baby some immunity. And as a pregnant woman, you're at high risk for getting really sick with COVID. You are in that high risk category because you're considered immunocompromised while you're pregnant. And so I would say, I don't know how to tell you late early in the pregnancy. My guess is don't do it in the first trimester when things are just settling in, and maybe not at the very end. So that's really up to you. I think my daughter-in-law chose like her 6th month, like middle of the, right in the middle trimester. That appears to be the cruising moment in the pregnancy. So my answer is yes, from everything I know, it's very safe to get. It's safe for a pregnant woman from everything I've read and the data that I've seen and my experience of people I know, family included. Do you think ivermectin can play a role? No. As treatment and for long haul, no. So I answered that already. One thing about long haul COVID. So I've been doing actually a lot of research about long haul COVID, and I have more to say on that. And I'm actually going to write a blog on that soon and send out a newsletter. So all of you here are on a mailing list. So look out for my write up on long COVID. I've put together like a supplement. I'm putting together like a supplement protocol for long COVID. The main thing about long COVID is you want to do 2 things. You want to repair the mitochondria. So it's I call it like mito recovery. You need to recover your mitochondria. They get really damaged from the virus, and your mitochondria, your furnace in your cells. And so that's why you have the fatigue and nothing's working. The other thing that it really does is it damages that enzyme, the angiotensin converting enzyme. And so you want to take supplements or nutrients that are going to repair and boost the activity of that enzyme. And so there's a whole bunch of supplements that do that. And I've been working on a new IV protocol. Our infusion center is open. And so we've been doing a lot of creative infusions to help people who are struggling with their immune system as well as long COVID. And so I actually just test drove. My sister went in and did our whole long COVID mito recovery IV today, because it's a whole new formula and I wanted to test it on somebody, so she volunteered. And so that all went well. So she had chronic Lyme for a while, and so the same kind of formula from mitochondria recovery is actually what long COVID people need, as well as chronic Lyme people. So I'm really been working on that. So more to come on that later. But it's not ivermectin. Okay. It's repairing it's about your body. It's about helping your mitochondria come back. Which are so damaged. It's about helping your sort of angiotensin, your ACE, remember that whole ACE enzyme? That's where the virus damages and disables the activity of that enzyme. And so you want to repair it. And so this is with targeted nutrients. And so, yeah, no ivermectin. I'm on Trelegy for lung issues from autoimmune disease. Are extra COVID precautions needed? I'm not that familiar with Trelegy, but I believe it is suppressing your immune system. So just like anybody else we've been talking about, if you're immunosuppressed, then yes, you need to take extra precautions, and you might need that 3rd shot. What would you consider to be the safest way to travel by plane? And so I just did it and it was fine. And so what do you mean? I don't know what you mean by the safest way, but I wore a 95 mask and I was just really careful. I don't think you have to worry about washing your hands 100 times and not using the bathroom. It's just about your mask. Okay. You got to wear the mask and you got to keep it on. And I kept it on, and I didn't take it off and eat on the plane, but I had a short flight. That might not work for everybody. There was a guy, I was in an aisle, the guy next to me in the aisle was busy coughing. Like, took his mask off and he's coughing, blowing his nose. And I'm thinking, oh my God, like all the passengers looking around, But so safest way, iodine in your nose before you fly, iodine in your nose right as soon as you get off that plane, and keep your mask on the whole time. Eat in the airport before and after. Find a quiet corner to take your mask off and eat, and wear a mask. I mean, a mask works, but it has to be a well-fitted mask. I found this N95, this duck mask that was so snug. You know how like when you wear glasses and have your mask on and the glasses keep fogging up? That's because the air is leaking above your mask. If a good fitting mask, you can wear your glasses and you'll be fine. And so it's called like the duck mask, an N95, and that's the one I wore. It was comfortable. It has room in the front for you to breathe and talk, and it's secure. So you just need a good mask and use the iodine before and after. And it really was fine, okay? It's a little bit of culture shock to be on the plane with so many people, but it really was fine. What lab test do you need to determine if you need a third shot? Well, I spoke about that already. So that's the COVID spike protein quantitative antibody test. You might not be able to get it. Some of you like just know you need a third shot. So there's the third shot and there's a booster. Remember, they're different. Third shot is for people that need a third shot to finish their series because they're immunocompromised. You can ask your doctor. They're going to be able to tell you which one you are. My arm has been hurting since the vaccine since March. It started out as tingling from injection site to elbow. Now the pain is on top of the elbow. I wonder where they did it. Now the pain's on top of the elbow. It's annoying. I worry about taking the booster. If I do, should I take it in the same arm? As I'm afraid to have the others, I took Moderna. Yeah, everyone I know had a big swollen arm. My medical assistant, her whole arm was red and like dead for like 3 days. What I tell people to do is use arnica. And so there's arnica pellets. And so you can do the homeopathic 3 pellets under your tongue up to every hour is needed for the discomfort and to try to help you recover. So I think arnica is a really good choice. You can put arnica topical, but also the pellets. And so I think arnica for the injection site. That doesn't mean you shouldn't do it. And I would definitely do your other arm. And it doesn't mean you shouldn't do Moderna. I think that's still okay, but do the other arm. Most people I know from Moderna had local, like bad arm, had arm reactions. Not so bad with Pfizer. Pfizer was just a little bit. But again, Moderna has twice as much in it than Pfizer does, twice as strong. What do you think about vaccinating teenagers, specifically if they got COVID? Well, the teenagers seem to be fine with the vaccine, and it's really the same answer that I gave about vaccinating people who had COVID. I still think that someone who had COVID should get vaccinated to make sure you want your immunity levels to be like super high. I think that different people who got COVID, they had different amounts of the immunity afterwards is just different for each person. And it's just with the Delta variant, it's just so contagious and so strong that it's almost, we just need like super immunity. So I do think vaccinating is good. Moderna hasn't been approved yet for a booster. It has nothing to do with why it's not safe. They said, why hasn't Moderna gotten approved yet for the booster? It's really just because I think they were just walking around going, our vaccine's great. Our people don't need boosters. Like Pfizer was already seeing that their immunity was waning down a little bit. And I just think Moderna was riding on the fact that their people's immunity was lasting a lot longer, that their vaccine was proving to be better out of the gate. So I think they just didn't rush to work on boosters. So I don't really know, but it has nothing to do with why they're not safe. And they are working on it, and I think the Pfizer people need the booster. And don't forget also, Pfizer was approved first before Moderna too, like by several weeks. So Pfizer started giving their shots first before Moderna came online. So I think they're just catching up. Is it okay to combine Pfizer and Moderna? I talked about that already. Not going to repeat that. The answer is probably, but we have no data. So so there's no data to know whether you'll have a great boost and what your immunity will be after that. How long are you going to wait to get Moderna booster? Is that about a year? What if you don't have access to the lab test to check antibodies? if you don't have access to, so I know we talked about that a bunch. So me personally, let's say if I couldn't check my antibodies, I got Moderna. I'm going to wait till the booster dose is out, because I think that I don't think you need a higher dose to ensure you get a boost. I think the lower dose is going to be just as effective, because it's the boosting action of having this distance of this time from the first shot. I think the boosting will be just fine. And so I feel like I'm just going to wait for the booster to come out. Because we know that Moderna people up to 8 months so far are good. And so there's no rush for the booster. And so again, for a healthy person who had the 2 Modernas, I don't know if it'll be a year, or it depends on what's going to happen. Like if I need to travel, or I'm going to have a new baby that I'm holding, I might decide, if the booster comes out, I might go get the booster. Even though my immunity is good now, I might still go get the booster, not the 3rd shot, but the booster. So this is just me, and I'm using myself as an example. So I don't know when you said how long are you going to wait, I assumed you were asking me. And I doubt it'll be a year, because I'm going to be a grandma. And I invite you to think about the different aspects of yourself and your life that will affect your decision, right? Because this doesn't happen in a bottle. I have friends that were going to Alaska on a cruise in September. So they ran and got a Pfizer booster even before it was sort of like we knew whether it was, but they had Pfizer to begin with. But they're 71 and they're like, we're going to go get a booster before we go on vacation. Good decision, right? So these are all the ways you're going to decide, that you're going to decide. I'm a Pfizer person, vaccinated in April and contracted COVID in July. Well, so you had breakthrough soon, quick. I'm still suffering long COVID symptoms, headaches, and fatigue. I have greater than 20 count antibodies. Do I need to get a booster shot? Vaccinated in April, and then you got it. So here's the thing: if you still have headaches and fatigue, sometimes the booster shot might help you with your long COVID. So long COVID people sometimes get better from a vaccine. It sort of helps your immune system clear out whatever's still not fixed there. And so I'm really sorry to hear that about the breakthrough. You probably, and I don't know what greater than 20 count antibodies, because my lab is like 250, it's like a different range. So I don't know if that's high or not. I would probably say, yeah, to get a booster, but I don't think you need it yet, because you just in July just had COVID. So you want to wait at least 3 months from when you had COVID. August, September, October. Yeah, I might wait. I don't think you should get a booster yet. I think you should probably wait until you're 3 to 6 months out from having had COVID. And then you might want to consider getting a booster and keep track of your antibodies. But that's a tough call. And so some people, the vaccination actually did help them. Oh boy, I don't know if I'm going to finish answering all your questions. Where can I go to get my antibodies tested? You have to just ask your doctor. And you ask for the COVID spike protein, the spike antibody test, quantitative. Quantitative means you're going to get a number, not just yes or no. So you want a quantitative spike antibody test. If you get a 3rd shot of Moderna due to being immunocompromised, do you need a booster? Probably not. That is your booster. I got my first Moderna and then got COVID 2 weeks later. How long should I wait to get the 2nd dose? 3 months after you got COVID. So the rule of thumb is get your vaccine 3 months after you get COVID. My husband spent extended time in El Salvador, where he received 2 doses of Sinovac. Last one at the end of May, back in the US, coming home to Mass in a few weeks. Should he get a new series of, I have no idea. I'm so sorry. 62, underlying conditions such as diabetes. Is protection from Sinovac sufficient? I would probably just get him a booster of something, 2-dose Sinovac at the end of May. But I would wait till he's 6 months out, or pretend that was like a Pfizer vaccine. Wait until he's 6 months out of since his last shot, and then get a booster, just like everybody else, and just change over and get Pfizer or Moderna. Do you recommend spacing flu and booster shot? They say you can do both at the same time, but you already heard me. I do recommend spacing vaccines. I don't think anyone should ever get two together. Just don't think it's a good idea. It's stressful on the immune system. From my research and allergist who confirmed this, the offender in Moderna is polysorbate 80. The offender in Pfizer is, thank you, that's right. Pfizer is polyethylene glycol PEG. I crossed it over and I said PEG was in Moderna. So there's the polysorbate 80s is the one that's in Moderna. Thank you for correcting me, or at least adding that information for everybody. Moderna is polysorbate 80, which can cause allergic reactions, and polyethylene glycol is in Pfizer. So they do have two separate ones, which is why you could, if you reacted or had an allergic type reaction to one, that's a good reason to consider crossing over to the other one. I talked about the children. Since the design of the vaccine is only to reduce symptoms, so, okay, the design of the vaccine was not to just reduce symptoms. The design of the vaccine was to protect you from COVID. But it turned out that because of, and initially it did, but it turns out that what happened was people, the virus mutated, and the vaccine ended up having incomplete protection, where it didn't prevent you from getting COVID at all for everybody. So the protection from getting COVID dropped from like 95 or something to 70% protection. But for the people who got COVID, they ended up not going into the hospital and dying. And so the language we use now for the vaccines is, well, it might not, so we only have 70% protection for getting sick at all. But you have pretty much 95% protects you from dying from COVID and ending up in the hospital, from getting really sick and dying. And so because of the Delta variant, the efficacy of the vaccine dropped. So now the 95% is, when we speak about 95%, that's about keeping you from getting sick and dying. But it's 70% good at keeping you from getting sick at all. And that's because of the variants, okay? Now, the question was, why are people referring to the unvaccinated as the ones who are spreading the virus? And so this is what I explained. I think this is one of the main reasons the virus was spreading this summer, because many of the vaccinated were unmasked, even though the vaccine has never been scientifically shown to prevent acquisition. Okay, so we know that the unvaccinated are the ones spreading the virus, because I actually explained this before, that actually the studies, it looks like vaccinated people don't spread it as well as the unvaccinated people. The unvaccinated people have much more virus in their nose, and they tend to spread it more. So, and it wasn't so much, I was explaining it before, not to accuse the unvaccinated as spreading it. It was really just to say that if you're vaccinated, you can worry a little less, because you're not going to spread it as much as an unvaccinated. You're not going to spread it as much. The reason why COVID spread this summer was because, yeah, everyone took their masks off, and 30% of our country's not vaccinated. And so the people who got really sick this summer, yes, there were breakthrough infections, but all the surges and the hospitals are filled with people who are not vaccinated. And so the virus spread like wildfire amongst people who are unvaccinated. It didn't spread. It doesn't mean that you can't possibly spread it if you're vaccinated, but you just don't spread it. It really made its way through the unvaccinated population. But I just needed to explain that when we talk about the way you said that the design of the vaccine is only to reduce symptoms and, to minimize COVID, that's not why the vaccines were designed. The vaccines were designed to prevent it, but they were initially designed against the original strains. And so now the vaccines aren't as effective at preventing it completely, but thankfully they're still super excellent at preventing hospitalization. And so the language that's used on TV now and in the news is, this is going to prevent, the vaccines they're really working to prevent hospitalization. Yes. And that's a really good outcome. But I wouldn't say that's was the only goal at the beginning. Do you think taking quercetin, NAC, vitamin C, vitamin D3, zinc may help protect your immune system if you come in contact with COVID? Yes. That's on my COVID prevention protocol. And you go to blumhealthmd.com, and you will see, if you go to the blogs and you search COVID, I wrote a whole blog on the supplements to take for prevention. And honestly, those are the same supplements to take for pre-gaming your vaccine, right? Because they're all sort of anti-inflammatories, keep your immune system balanced and healthy. From what I read, the viral load of the unvaccinated and vaccinated are very similar. In fact, some studies have shown a higher viral load in the vaccinated. Well, thank you. And so I've read some of that as well. And so part of it is because the immune system and they're pretty much similar at first. But what happens is vaccinated people will clear it quicker. Like you turn negative faster on your test because the immune system's primed and it doesn't. And so you end up with a viral load and then it clears. So separate from the viral load, which maybe I had that wrong and it's more similar than maybe it's just about that it clears quicker. I have read that vaccinated people are not, there's this thing called a row or the spreadability, and that vaccinated people are not infecting other people as easily, even though perhaps it's still, ends up in their noses, right? Which is why the iodine swabs are so good. We all need them because we still have, we don't have our immune cells are not in our noses. Our noses are sort of outside the body. So the virus can pile up there until we realize it's there. And so sometimes we can end up with too much in our nose, but as soon as the immune system realizes it's there, it clears out. The Argentinian study. My 37-year-old son took prescribed ivermectin during a COVID infection, said it was the one thing that really helped him. Okay. And I would like to know that I wished that was true. For some reason, every study, and they really tried to study this. They wanted to make it, we wanted it to be good. Nobody didn't want it to be good, but the studies just haven't borne that out in amongst people. And an N of 1, your 37-year-old, I mean, who knows what else he was doing? And there's something called the placebo effect. And he could have started feeling better anyway. I don't know. What home test do you recommend? I don't know. We're doing the Abbott one, from CVS. It's fine. My 16-year-old son had COVID this August. How long should we wait before he gets the vaccine? 3 months. Do you think indoor cycling classes are safe? If everyone's vaccinated, I think without your mask on, in the cycling class, you're still risky. And it depends on where you live. If you're in a community where the amount of, once the surge is over and we're down to like 1% positivity in the community again, or under 1%, I think that's probably safer. Right now, there's a lot of, we're not out of our surge yet. So I think right now I'd be a little bit nervous about that. And hi, Lauren, we've talked about that, me and you. So, I know where you live. I'd be nervous to do that without your mask on. That's hard to do in a cycling class. If everyone's supposed to be vaccinated, how do you know for sure? I'd be a little nervous right now until we're out of the surge. So I'm not sure I would want you to do that or anybody. Yeah, hi, Nancy. So what's an antigen? An antigen is sort of like a protein that's on the virus and it's like the name tag. It's just it's a marker on the virus that makes it unique to that virus. So when you can actually, you do the test and the test is looking for that little name tag that says COVID, and it's just called an antigen. But it's like a test looking for a piece of the virus kind of thing. Since this shot is not considered to be a typical vaccine, and since this shot is what's called a leaky vaccine because it does not prevent acquisition or transmission, problem is that a virus will always try to survive. The studies have shown that with masking, social distancing, and the vaccine, the virus is now very determined to survive, similar to the concept of antibiotic resistance. Okay. I have had a low white count lately. Does that mean I'm immune compromised and should get a third? No. 3.3 is not terribly low. And there's all sorts of reasons why that white count could be a little low. Sometimes that's just about your circulating white count. That does not mean you're immune compromised. You can wait for, and yes, you can wait for a booster. You're welcome. Should you get second vaccination if you got COVID after first shot? And I would say yes. Because you got COVID after the first shot, you weren't completely immune yet. Finish your vaccination series and get the second shot. Do we know what percentage of breakthrough infections are Pfizer, Moderna, or J&J? Good question. We don't. And I'm really looking forward to that data because it'll be interesting. We also don't know, it's not even just about the 3 vaccines. It's individualized for different people. Some people are immunocompromised. It doesn't matter what shot they got. They never had a really good immune response. So we have to figure out the breakthrough infections. What were the characteristics of those people? Was it which vaccine they got, or was it themselves and their own health issues that are the issue? For someone who has had COVID and their sense of smell and taste comes and goes, do you have any recommendations? That's really about the mitochondria and the recovery from the long COVID recommendations. So stay tuned. I'm going to send some more info out on that, but that's really like the mito recovery piece. What's the range you want to be in for the antibody test to be considered covered? It depends on the test. So I just know that the Northwell one I'm using says greater than 250 is just the highest amount. It just says greater than 250. The people right after their shots that are super immune or have the have the original like high level, it just says greater than 250. Quest and Lamport, they have different weird like I don't know what those numbers are. So I don't know. I don't know. And it's because it depends on your test. So I can just say Northwell Health, that antibody test, it says it's greater than 250. Sure, I recommend Johnson & Johnson is fine. I actually think Johnson & Johnson has a place for people who are nervous about the RNA vaccine. I think, so do I recommend it? Yeah, I mean, it's fine. I think the RNA vaccines, though, have done great. So I think that you have to decide for yourself. I think getting any vaccine is just a good idea. Will our immune systems be weaker because with masks, because we're exposed to less germs and colds? I would say at this point in my life, I've been exposed to a lot of things already. So I don't need to be exposed in an ongoing way this year to more viruses to keep my immune system toned. So I think in this short run of these couple of years as an adult, I think we're fine not being exposed. What do you think about X-Clear spray? I like X-Clear. And actually I saw somebody, X-Clear is grapeseed extract for, versus iodine for clearing the nose. The only thing I'll say about that, because I was asked about this and I saw a question or a discussion about X-Clear. If you go onto PubMed and you search PubMed for studies on nasal rinses or nasal prevention treatments, for COVID, in the ENT, ear, nose, throat literature, they have all these discussions about, nasal sprays and like things to do for COVID. They talk about iodine. There's not been a study that I could find on grapefruit seed extract and X-Clear. But that being said, it's supposed to coat the nose and maybe it'll prevent from landing. I don't know that grapefruit seed extract is strong against viruses. I have that in the office. I like that a lot. For people with chronic sinus infections, I use it. So I think it can't hurt, but I just don't know there's data that I know it's virucidal, that it'll kill viruses. I just don't know for sure. Even though I've seen blogs and people talk about it. What do you think about Thanksgiving gatherings? Definitely. There's a way to do it all safely. Get together for Thanksgiving. Everybody can do one of those quick tests in the morning. Everyone can agree to be careful the week before. So starting Monday, Tuesday, Wednesday, Thursday, starting the weekend before or 5 days before, everybody says we're not going to go indoors with our masks off with other people. And then everyone does a quick test that morning, and then you can all gather with your masks off if everyone's vaccinated. I mean, there's a very sane way to manage this now. But I do think everybody has to decide to be careful for the 5 days before the gathering, meaning indoors masks, right? With people they don't know. Outside your bubble, put a mask on if you're indoors. Don't do anything risky. And that's where I think we can use those quick tests, and everyone should get a kit from CVS or Walgreens and just do a quick antigen test themselves at home that morning, and then you're good. Have you heard of different side effects after the J&J vaccine? No, I don't think so. Well, I can't get into that now. I'm actually going to wrap us up. So I sure, probably, but we're not going to get into that now. I mean, yeah. So, J&J had the whole clotting thing that everyone was worried about. That's the only thing that comes to mind. Where do you get the iodine swabs? I got them on Amazon. Okay, they're just called, if you Google iodine swabs, it should come up. It's this pack of 150 individually wrapped Q-tips that have iodine in them. And the PCR saliva test is great. And you need to do that also. And so we did that, that is like guarantees. But the problem is PCR test, you won't get back till the next night. You do it one day, you get it back in the next evening. So for Thanksgiving, you could do the PCR one as well. And so you'd have to do it though Tuesday. And then you want to get it back till late Wednesday, if you're lucky. And then maybe not till Thursday. If you did it on Monday, it's still days away. You see what I'm saying? You could do the PCR test, but then it's actually just feels really safe, and you just feel sort of an extra sense of safety if everyone just does the quick test the morning that you're getting together. All right, team. So that was the Q&As. Now, I do see that a lot of you ended up sticking stuff in the chat, and I'm sorry about that, but I am not going to be able to go through this. Am I seeing unvaccinated patients in person? No. I'm seeing vaccinated people my vaccinated people that want to come in person. I'm seeing them in person. I'll let them come in in person. Unvaccinated people, we do Zoom. There's no reason to spend an hour and a half or 2 hours with a mask on, together in a small room. Unvaccinated people are welcome to come in and do our infusions and do IVs in the office. We just we have multiple rooms, so you can have your own room. But yeah. So I think I pretty much covered a lot of stuff. And I think we're going to wrap things up. Most of you just saying, explain the iodine swabs. Okay, good. You're very welcome. All right, good. So deep breath. I said I was going to be 45 minutes, and it's almost an hour and a half. I'm sorry I kept you all so long. But I think I got through most of the questions. I hope you all enjoyed our conversation today. Remember, this is not medical advice. Excuse the cat. Ugh. Remember, this is not medical advice. And the most important thing to keep in mind is you need to personalize this for you. There's so many things that weigh into this decision. But as we leave each other today, I just want to say that this is a really important sort of decision, but you're all here and you're all thinking about it, and you're all really figuring out the safest way to protect yourself. And that is really, really good. As the days get shorter and we're heading into winter again, I'm a little depressed about it, I will say. Anticipating another sort of cold winter. I do have a baby on the way, my little granddaughter who's coming. My first grandchild. So I have something joyful to look forward to, so that's good. But man, I have to quarantine. I have a whole protocol I'm going to have to do before I see that baby. And this is just the way it is. So we're just going to all buckle down. We're going to get ourselves boosted when the right time comes for each one of us. We are going to stay safe. We're going to keep our masks on indoors with other people, because this virus isn't done. It's going to continue to ravage areas where people aren't vaccinated. It will break through and infect those of us who are vaccinated if we are not careful. And so, yes, we don't have perfect protection, but the boosters will help us, and so we can get it better. And that's what the Israeli data showed. The third shot, the booster, It's really brought down the hospitalizations. It really brought down the breakthrough infections. So we're going to get there. Okay. But this winter, we're still here a little bit. Okay. So we can't do a big dance. But I don't know about you guys, but like, I'm not afraid I'm going to die anymore. You know, like a year and a half ago or a year ago, the fear was palpable everywhere we went. It was like we were afraid we were going to die, you know, if we got COVID. At least now I don't have that fear, you know, so I feel safer. I feel like I'm back to life. Our office is open again, I'm busy, busier than I want to be. I want to go back to those first 3 months when I was reading, novels, sitting on the couch. And so, but we still have to be careful. So let's all pray and set the intention and hope that this spring, we will really be coming out of the tunnel and this will really finally be behind us. But I think we've got another 6 months to go. So I don't know whether that's good news or bad news to end our talk, but that's my opinion. All right. So be well. Nice to see you all. And I hope this was helpful, and look for some emails over the next few days. We're going to send this out and some other information that might be helpful. Okay. Take care.